you for joining me on my presentation on Moxa and how to turn your breech baby. There are a couple of different factors that bring you here, and the most obvious one is that your baby is in breech presentation. I just want to take a moment to help settle some of those concerns, some very real concerns. There's a lot of information out on the internet and it's often contradictory and conflicting in its nature. So I really encourage you to read through my blog, where I hope I've deciphered through some of that information for you. The other thing to know is that the technique I'm about to share with you is one that has a success rate of 70+%. So please feel confident that what we're about to do will have a huge impact in turning your breech. The other factor is that you've probably already seen myself or someone like me, and we've already gone through that initial stage of treatment with you. It's really important to have that support right now. So if you haven't done so already, I encourage you to find a registered acupuncturist or Chinese medicine practitioner, or to contact myself if you're in Melbourne, and I'm really happy, and they will be also, to show you this technique, which is very safe. Very low risk for the mother. It's completely non-invasive. What it does require though is 10 days of consecutive treatment. But the beauty of this is that it is so safe and so easy to do that I can show you, or another practitioner can show you and your health partner how to administer this treatment at home, making it also very cost effective. Okay, let's get started. So we need a couple of things to get started. The first thing is our Moxa stick, and this is what it looks like. Your practitioner would have supplied you with enough of these. What this is mugwort, and the reason we use this is because the ash clumps together and making it quite safe. So the other thing you're going to need is something to ash it in. I've got my kidney dish, but you can use anything. You can use an ashtray or a saucer or any heat-proof dish to ash your Moxa in. And the last thing is you're going to need something to extinguish your Moxa. This is just a traditional Moxa extinguisher, but you can use a jar with sand or a candlestick holder. Okay, so to get started, you get the woman to sit in a comfortable position, or if you're doing this to yourself, you can sit with your legs to the side, your feet to the side, or you could have hollowed out a potato too to make a makeshift Moxa stick holder. So we light it, and it takes a little bit of time to get started, but once you get the embers nice and hot, it will keep lit. So that's why it's so important to extinguish your Moxa stick properly. So you can probably already see how smoky this is and why it's so important to do this in a well-ventilated area. And you can see it's just really picking up now. And that's it. That's how hot you want it. Now the picking motion that I do and that I describe is basically this motion. You want to make sure that the heel of your hand is well rested somewhere, and you just slowly peck towards the toe this way, being very careful not to touch the toe. You need about 1 centimeter's distance between the tip of the hot Moxa stick and the toe. Mugwort has a way of really building in its heat, so what's quite comfortable to begin with can get hot quite quickly. So just be mindful of that as well. Okay, now ready to do a demonstration on the actual foot. And there you have it. It's that simple. The main thing is that you do it on each toe for at least 20 minutes. The toe will heat up. It will get very, very warm, and it's meant to. And when that happens, just take the Moxa stick away for a few moments until the toe cools down, and then just reapply the Moxa, keeping it up for that duration of time. Now, if your baby turns, then you will still continue the treatment for that allotted period of time. So you still want to do those 10 days. But what changes is the duration of the treatment. So instead of 20 minutes, we then drop it down to 10. So I really hope this has been of service to you. Please feel free to ask me any questions. And again, thanks for joining me, and goodbye.